In this lesson, we'll review some basics about the Medicare program. After completing this lesson, you'll be able to describe Medicare Parts A, B, C, and D. Medicare is a federal health insurance program run by the Centers for Medicare and Medicaid Services, commonly known as CMS. Medicare serves all Americans age 65 or older and adults 18 to 64 who meet their disability criteria or who have end-stage renal disease. Medicare coverage has four components: A, B, C, and D. Each part provides coverage for specific services. Medicare Part A is sometimes called the original Medicare. Part A helps cover inpatient care in hospitals, skilled nursing facilities, hospice, and home health care. Typically, Part A is free for Medicare enrollees. Medicare Part B covers services like doctor's visits, lab tests, surgeries, and medically necessary supplies to treat a disease or condition. This is additional coverage that the patient has to subscribe to and pay a premium. Patients may have to pay a share of cost for certain health care services. Part B also covers certain preventative health services. These include HIV screening, pelvic exams and Pap tests, screening and counseling for sexually transmitted diseases, and tobacco cessation counseling. At this time, Medicare Part B covers these specific vaccines for adults: influenza, pneumococcal, and hepatitis B. To look up current Medicare vaccine coverage, you'll want to check regularly with the State Medicare Administrative Contract, or MAC. In California, this entity is called Noridian. You can refer to the downloadable job aid contacting the Medicare Contract Administrator. Tdap may also be covered by Medicare if it's determined to be medically necessary. Let's look how that determination would be made.
Hello, this is Athena Kinsley, Health Insurance Specialist. I'm popping in to share a scenario. We're going to look at an example where Medicare Part B may cover the cost of a Tdap shot. Imagine Martha Miller, a 70-year-old woman who's covered by traditional Medicare Part B. While gardening at home, Martha cuts her finger with a rusty tool. She can't remember when she had her last tetanus shot. Martha comes to your clinic. By taking the patient's history, her chart should reflect the reason for her immunization. Namely, she had a superficial wound on her left hand and needed the tetanus vaccine. Both the type of injury and location of the injury, like at work or at home, should be documented. Medicare requires documenting the location where the injury happened because they need to know if there might be a third party responsible for this service. If the injury had happened at her local grocery store, then the grocery store liability insurance would be responsible. In this case, Martha's home gardening tool injury posed a risk of possible tetanus infection. This shows Medicare that the Tdap vaccine is medically necessary. Let's imagine Martha didn't have an injury, but wanted to get Tdap to protect a newborn grandchild at her house from pertussis. In this case, Medicare would not cover the vaccine under medical necessity. That's because the vaccine has to be given to protect the patient's own health, not someone else's.
Many Medicare beneficiaries decide to purchase Medicare Part C. This is commonly known as a Medicare Advantage plan. Patients who elect this type of coverage surrender their original Medicare. The Advantage plans include both Part A, hospital insurance, and Part B, medical insurance. Advantage plan enrollees usually pay a monthly premium in addition to their Part B premium and may be responsible for co-payments or co-insurance for their covered services. Private insurance companies approved by Medicare provide this coverage. In most plans, the patient needs to use plan doctors, hospitals, and other providers, or pay more or all of the costs. Like other HMOs, Medicare Advantage plans will not reimburse your public health clinic for services their enrollees can get from their own Medicare Advantage network providers. Medicare Part D is an add-on benefit that patients can purchase if they choose. Part D plans cover prescription drugs and some immunizations. Specific coverage can vary by plan. Typically, Part D coverage is utilized through pharmacies, and subscribers should receive a separate Medicare Part D card to access their benefits. As a refresher on all the parts of Medicare, you can download the job aid, Understanding Medicare A, B, C, and D. Now please follow the instructions to take the quiz for this lesson. It'll look familiar. It's the same one you took before viewing the lesson. This time you'll be able to see the correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.